So I had this patient at one point a number of years ago who we kept seeing in the office, and we couldn't get her diabetes under control. We kept adjusting her insulin, but her blood work just kept telling us it was really poorly controlled. And so we did a home visit for her and realized that this family didn't have a house that maybe you and I would consider safe to live in. So there were holes all in the floorboards. There were roaches all throughout the house. They didn't have reliable power. So, things like us asking her to use her insulin reliably, well, she didn't have a fridge that was powered that she could keep her insulin. So of course she wasn't using it reliably. When you have a house that's infested with bugs, your wounds aren't gonna get better. You're not gonna be able to reliably keep those clean. I'll never forget that home visit. It was one of the scariest and just most heartbreaking scenes I've ever witnessed when we walked in and saw the way that this family was living.
So I kind of view healthcare, as we all should, on kind of like a Maslow's hierarchy of needs. If you don't have access to the basics, just food, transportation, shelter, you can't expect your health outcomes to increase, just like you wouldn't expect your own livelihood to increase if you can't meet that foundational space to have a happy and healthy and whole life.
When someone has a chronic illness or physical need and they try to function in a home that is not livable, oftentimes it means they won't have access to the medical care that they need. And so it becomes repetitive in terms of their entry back into that medical system, particularly the emergency rooms. For those that may not have insurance, this becomes an additional financial burden because they have an illness that may or may not have been created by the home, but they're returning to a home that will most likely make it worse, and they don't have health insurance. So they are having repeated visits to emergency rooms, which are expensive. It just snowballs on itself because the home is not in a condition to actually perpetuate health.
Being the federal co-chair of the Appalachian Regional Commission, I've traveled throughout Appalachia. Affordable housing is just a major concern throughout the region. And of course, there's many reasons for this. Many of our communities have homes, but they're aging homes. They're homes that people maybe have been in for generations in their family.
So much of what we see in substandard housing in this area is dilapidated structures, so mechanics of a home not being adequate for the number of rooms or people living in that home, or you've got a leaking roof, or it's not handicap accessible. So as people age in place and stay in their homes no longer support their needs so that they can live and thrive.
So we see people who maybe live in an area that's so rural that they can't get, it's not easy for them to get the services or the repairs that they need. So they both can't get the health services that they need, and they can't really get, the home services that they need. And that just leads to a situation where things kind of deteriorate and they're not able to have a safe, stable housing environment.
Now you're telling people they have to weigh with the income that they have to weigh, are they going to be able to invest in their home, or are they paying for medical bills? Are they paying for treatments and medications? Are they paying higher rates on their heating and their energy and their water because their homes are not efficient? There's not a good choice, because if they choose one, then they're putting themselves in jeopardy in another arena. It's very unfortunate.
That bookshelf, I built that. It was over there. Now the things in there are basically pretty much what meant something to my wife. I kept those. And then if we go to this bedroom here, you will see that they have made it so much better and easier. If my kids come in or someone, I have a place for them to sleep. You can notice all of this in the new vents This is just a kind of a catch-all at one time. I think the biggest thing that's helped me is the fact I had a bunch of old carpet here. And being COPD and having breathing issues and oxygen, when they got that old carpet up, they removed about 20 tons of dust. And my breathing has gotten better. I'm using a lot less oxygen simply by removing the carpet.
So research conducted by Habitat for Humanity International shows that an estimated 39% of asthma diagnoses for children younger than 6 could have been prevented by addressing and eliminating environmental sources such as dander, mildew, inadequate heat sources. So that tells us there's a very clear link between the condition of one's home and their health outcomes.
From the context of ASP, the short-term solutions to housing and health issues are relatively simple, and it's that we go in and fix the immediate needs in a house. So we're replacing floors, we're installing insulation, putting new roofs on, doing wheelchair ramps, making accessibility modifications inside a home, and that makes an immediate difference and really can change a life right away. I've had many healthcare providers tell me that they can treat a symptom of an issue, that they might be able to give an inhaler for someone with asthma, but if that person goes back into a home that has mold or is burning a fuel source for heat that gives off carcinogens, then their recovery is not really going to happen the way that you would expect it to happen if they had a nice, safe place to live.
In front of us right now, there are hundreds, if not thousands of people in East Tennessee that need an affordable and safe place to live. So one of the ways that we're tackling that is through, of course, maintaining our existing housing stock, because we have to protect that.
My hope is that home repair and maintenance becomes a more common conversation. Within neighborhoods and communities throughout the country, it isn't being talked about, even at a neighborhood level. More people that understand how critical this is, not just for one household, but for their neighborhood and their entire community. Our hope is that people will step up, whether it's as a volunteer, whether it's funding, because each home is a part of a community. And we should be addressing this and tackling it as a community.
I think we are in a time where folks are starting to recognize that health and housing are truly aligned in ways that we can no longer ignore. Every time that I have a strategic planning meeting with my community, I never fail to see the love and the kindness and the hope for a better community. And I think if you truly want to make a difference within whatever region you're in, whether it's East Tennessee, Central Appalachia, any other area of the country, you have to get multi-stakeholder engagement and also include the residents there as a vital piece to the puzzle.
If I meet someone and I know their name and I maybe find out something about them, where they're from or how many kids they have, and then I find out that they don't have housing, I would think, oh my gosh, I really want to help this person. There's someone that I know. I wonder if there's something I can do to help them. And on the other hand, if I see a stranger who's walking down the street and maybe looks like they're homeless, then the instinct is more fear or discomfort. And I think if we can just shift that to remember that these are my siblings in Christ, right? Like whether I know their name or I don't, they have a name. Whether I know their story or I don't, they have a story. And so if we can approach all of that with kindness, I think that just makes a huge difference.
You know, when we talk about the commonality that exists throughout the Appalachian region, the mountain ridge, we're connected by our mountains and our rivers, our heritage, our culture, but there seems to me that the commonality throughout Appalachia is also this family spirit is embedded in people, that you just reach out to others and it's family. And I think a lot of that comes because of our resiliency, that we have grown up in a tough land with a lot of challenges, but we've overcome them. But we know that we haven't done it alone. We've always known that in time of need, we would have someone to reach out and they would be there for us. And I think that's probably the greatest quality of all that we have in Appalachia.